Hello, everybody, and welcome back to the Youth in Transition Policy Summit. We are going to reconvene and discuss Utah Department of Juvenile Justice and Youth Services. I'm going to introduce our two presenters that we will have for this policy. Our first presenter is Dr. Jesse P. Higgins, Clinical Director for Utah Juvenile Justice and Youth Services. He received his MS in Marriage and Family Therapy from a joint program of the University of Nebraska-Lincoln and University of Nebraska Medical Center. He also has a PhD from Utah State University in Human Development and Family Relations with specializations in adolescent development and parenting. He has practiced individual, couple, and family therapy for over 10 years, is a clinical fellow and approved supervisor with the American Association of Marriage and Family Therapy. On the weekends, he likes to read comic books and consume Snickers and gummy bears. And our second presenter is April Graham. She is the Interim Director of Utah Division of Juvenile Justice and Youth Services. April Graham is the Interim Director. She has over 25 years of experience with juvenile justice service in most of all of its capacities, from facility work to case manager. She has been largely involved in building case planning for JJS case managers and in reform efforts and the implementation of Family First Services and Prevention Act in Utah. This included building processes for implementation practices to adhere to changes in statute. April has a bachelor's degree in psychology from the Utah State University and a master's degree from the University of Utah in social work and is a licensed clinical social worker. I'm going to assume she likes gummy bears and Snickers too.
Not really gummy bears.
So we just kind of wanted to briefly start out by kind of reviewing some of the reform efforts that we've had here in Utah. A lot of this started in 2017, where kind of the short end of it is we looked at ways that we could make sure that the right youth are in the right settings and really trying where we can to remove, youth that are low risk for recidivism in our, kind of deeper end situations like detention or secure care. A lot of legislation passed allowing us to do that. And so we've then shifted a lot of our, services and funding that was freed up to the front end with youth services and early intervention programming in the schools that's voluntary and all that kind of great stuff. The other piece of it too is that we've also extended that we can continue to work with youth up to age 25, which is positive so that those youth aren't necessarily going into our state prisons. And I think that's really positive to have, developmentally, we understand, there's, even though legally they're adults at 18, there's some of that developmental piece that doesn't really come into place. And, it's not a smooth transition into the prison system as well. I was down there last week touring the new facility that we have here in Utah. And unfortunately, all new folks that come to the state prison are in maximum security isolation for like 6 months to kind of determine in their level of risk and need and things like that. And that's just not great. For those of you that are fans of John Oliver, he did a great piece on removing seclusion and isolation this last weekend. And while it was mostly talking about adults, like we've really taken those lessons and are a promising site as far as reducing the use of seclusion and isolation for the juveniles that we work with. So that's kind of like, I guess, some highlights. I'm sure, April, you've got a lot more to say about that than just those brief pieces. But anything else on like the reform side that we want to touch base on?
Well, and I think it's also important to understand that while we were going through reform efforts here in Utah, our Child Welfare Agency was being presented with the Family First Services and Prevention Act, which also really is looking at how to end congregate care. And as part of that, with our division, our sister agency to DCFS, and we wholeheartedly jumped into that knowing that we could possibly get some federal dollars to help with our early intervention services. So as we have reinvested some of the money from incarceration reduction and custody reduction, we've also looked at ways that using Families First Services and Prevention Act also to inject more funding into the front end of the system. So we do have a pretty robust early intervention system that allows for youth who are not justice involved, and pretty much anybody can refer a youth into our early intervention services. For kids or for federal funding, the qualifier is that the youth is at risk of coming into custody, and that could be DCFS custody or JJYS custody. It also looks at trying to prevent youth from going further into justice involvement in probation. With that, the federal government has a clearinghouse of evidence-based programming that they require the use of if those kids qualify. And it's usually for either a youth or parent with mental health issues or substance use issues, or a parent that might need some more parenting issues for conflict in the home. We've partnered with DCFS. We have a pretty good system when CPS is called for a case and youth are referred, like if it's a conflict situation where there's no abuse or neglect going on, but there really is that child and parent conflict happening, that they can refer those kids and that family to youth services. I just want to touch on that. And then the other piece, I think when you were talking about the prison system kind of transfer, I think we have two mechanisms there. They have, we can serve kids in our system up to age 25 who are usually younger, that commit crimes that are pretty serious in nature. The other cohort, though, are kids that are actually ordered into the adult system, but we actually serve them until age 25. I guess if that makes sense, just to clarify that a little bit. Anything else, Jesse?
Yeah, I think that kind of sets the good stage for a lot of the contextual reform pieces that kind of lead to this particular policy change that we've been asked to speak about, as far as allowing some voluntary services, access to voluntary services for youth that were in our custody and after they leave our custody. And as we've talked about, a lot of this started with the Second Chance grant that we had, or still have, that allows some funding for vocational training and help with housing, those kinds of things for youth in our custody. And then also too, April, you've talked about as well the piece with the youth councils that and bringing in that youth voice and kind of listening to the types of services and things like that they needed and that they requested. You meet with them regularly and get some of those ideas. And so, I mean, I don't know, this has kind of turned into a question answer just between us, but I wonder, April, if you'd be willing to kind of talk about that piece as well.
Yeah, I want to answer a couple of questions that are in the chat before we move on to the policy actually that we're chatting about today. There's a question about how can other agencies support your early intervention efforts for youth? So I talked about DCFS. So one area I failed to mention is that we are also in the process of amending our prevention efforts with the federal government for the Families First Services and Prevention Act to include probation. Right now, we allow for all of our provided services or contracted services to be available for probation for kids who are at risk. So we also wanted to get our partners from the courts involved in this as well. We I think from other agencies, it's just, we just continue to educate and let people know that if they are hearing about a family or a youth in need of these types of services, that there's a referral online and anybody can refer. And then the other one is for the youth who have to transition into adult facility, is there anything in place that educates them on what that will look like? So fortunately, we don't have a large number of youth in our incarceration system. I think right now we're about 96 kids, 94 kids. I didn't look at the pop report this morning, I should have, but there's about 90-ish kids or youth. And out of that, we have a handful of kids that are going into the adult system. We have a really good relationship with the Department of Corrections. And when we've had these situations come up, we've done some work to have one of their caseworkers come over and come and educate this young person on what's going to happen next. We're working on trying to get some other things in place sooner, but with their prison move and some other things that are going on with the prison right now, they're pretty busy. The other thing we do try to partner with the Department of Corrections, and these are kids that are not necessarily going to prison, but they may transition out of one of our secure facilities or in the community and end up with adult charges and end up on AP&P, adult probation and parole supervision. Is we actually do not terminate our youth on our side. We continue to broker services to help them be successful in the terms of their supervision for the adult side. Okay, so then I'll go on. Now, what was the last question? Where am I supposed to go? Oh, youth council. So currently, I know I'm lost already. Sorry. Every quarter, Brett is the normal director for JJYS, but he's been on a special assignment with our partners with corrections. But we meet with our youth council every quarter, and we listen to kind of the things that they're asking for and what they need in their facility and actually moving forward. The other thing that we have in place to try to determine what transition needs that a specific youth would need is we have a survey that goes to them about 90 days before they transition out of the facility. They also have child and family team meetings every month. So the facility and the case manager, the parent, the kid all have voice in that meeting. They all can explain and kind of work through what that transition looks like. But in that last 90 days, the purpose of this survey is really to look at, how things were provided for them while they were in the facility. And if there's specific interests they have in transition, and then we link that survey back to the right person that can go in and talk to them specifically about their transition needs, whether it's vocational, higher education, employment, or other needs that they have moving outside of that facility.
There's another good question in the comments as well, April. Are there current aspirations or partnerships that can link with JJYS to further support youth that will assist with their individual next steps? There's a lot of great things that we have going on. I'm thinking of like the mentorship program, or we have one of our partners where where there's mentors with lived experience that we contract with that are able to come in and work.
Messengers.
Yes, credible messengers. Yeah, absolutely. To build those relationships and kind of, so it's not staff, it's not therapists, it's not, JJYS folks, but somebody from the community with lived experience that could kind of help them. I think that's a big piece.
And those youth are provided with aftercare services when they leave our facilities. They also are, linked like with our credible messenger. They have a case manager. They're often meeting. We also have some like TAL programs that kids can participate with. And we have two types. We have kind of a traditional TAL program, which is transition to adult living, that is in a provider's home, but it is a separate apartment from the home itself. So it might be a basement apartment or something like that, where they learn adult living skills, how to budget, how to prepare meals, how to shop for meals within their budget and things like that. And also getting them linked to jobs and other community services that they may need. We have a pretty robust WIOA program that's through the Department of Workforce Services that helps with kids who are continuing education. They offer incentives to youth, both monetary and other things to kind of get them through those pieces. They also help with job skills and other soft skills to help them to be successful. And then the other piece is a transition to adult living program that's in kind of a residential support home. And we typically use this type of home with kids who have cycled through incarceration. So they might have had, one or two times that they've gone back to secure care after being there once before, and transition was an issue and they ended up back in secure. Or if they are really high need youth who, they need a little bit more specialized help to kind of link them to community services. We also try to get them linked if they have mental health or other kind of deficits to the local mental health authority, to provide aftercare services beyond us. Like, we're really trying to get them connected with whatever those community resources would be when they leave our system. But I guess getting into the fruit of this policy that we were kind of excited about was a couple years back, just before reform really set in Utah. We had the opportunity to participate in a second chance grant through the Office of Juvenile Delinquency and Prevention. And this grant allowed for us to pay for housing, vocational education, and other types of transitional needs that a youth would need to be successful in transition. So as a part of that, we started to figure out that there were far more kids than we realized that needed housing help, especially. And I don't know about everybody else here. I think this is national, or there's folks outside of Utah. I'm not sure how hot your housing market got, but ours has been just barely slowing down. But it got pretty high there, and our wages really just don't support it. So several years back, we had, and this was way before inflation, we had found that a youth would need to make at least $22 an hour to support a studio apartment. And it's probably a lot worse now. I know rent is crazy, and we have kind of a housing crisis in this state. So this was one of those areas that we felt like could be very helpful for kids who get stuck in custody just because of housing issues. So as we participated in this grant, we really kind of mapped out how much this would kind of cost the division, and how do we earmark some of this money that we're saving from the reduction of kids in custody. And that's what we ended up doing as this grant ended, was just making sure we budgeted for these young people to have this opportunity. And it didn't really cost us a huge amount of money. And in the end of the day, I think some of the other thought process behind this is, as we see kids at the end of their custody stay, especially older kids, a lot of times their families are burned out and they won't allow them to come home, and they want to support them from afar. So we wanted to also make sure that these young people had an opportunity to come back and get extra support when they left custody, if that's what they needed. The other things we heard from our private providers is that they often had kids come back asking for mental health services or substance use services. And we thought that was huge for them to be asking on their own. And we wanted to support that effort, knowing that these kids, if they're stepping up on their own, a lot of times that will help prevent them from going deeper into the system. So we started into this voluntary service agreement with these young people. So about, and I want to say it was 2019. I know it feels like Groundhog Day, it might have been 2020, that we started the first piece of policy through legislation to allow for youth to receive services up to age 21 after they left custody. In the meantime, our age shifted as well. Like now we were serving some kids up to age 25. Knowing that we were going to have some of these youth come out as well, we wanted to make sure that we had equal opportunity for them to participate in voluntary service agreements. So last year we were able to champion one of our senators from our legislature to run some statute change to allow for youth to receive a voluntary service agreement or services after they leave custody up to age 25. So we could have potentially a kid who leaves at under 18 and come back to us when they're 23 and say, hey, I had this service back, umpteen years ago, and I really could use some help now. Or I've lost my housing and I really could use some support. And then we would be able to help provide them services for up to a year. So we've been running this for about a year now, up to age 25. And I think we've served about 50 kids this last year, 49, it looks like. I think this is an interesting situation as well when we look at our custody system. Overall, there's about 350 kids in custody with the state of Utah with JJYS. And like I said, about 90 of those are incarcerated. When we look at our females in this state, we had far more than a 50% decrease in custody. I think we are right around 30 girls. I think at the beginning of reform, we had about 150. So you could see how dramatically that went down. So out of the youth that are receiving some sort of aftercare, this voluntary service agreement, we have about 11 that are female, so about 22%. Let's see, and 38 of them are male, so about 77%. We have 31 that were white, so about 63%, 18 that are non-white or Hispanic, 36%. Let's see, most of them are over 18. The average is about 18.2, but they range from 14 to 20. We don't have very many kids in custody that are over 21. I think we have 2 right now, since this is kind of newer legislation. Sorry, I'm looking at this chat at the same time and trying not to get distracted. So in state custody, including DCFS, no. DCFS has a far larger number of kids in care than we do. Our custody system is quite small. And just to give you an example of what we're looking at, like back when reform was going on, I think we were serving about 700 kids in custody. We're down to 350. Previous to that, we had kind of a small footprint in early intervention. We're serving close to 700 kids a day now on the early intervention side. So those kids that we definitely decreased on this custody end are still getting served. Sorry. I'm just laughing at the chat. Sorry. Anyhow, and let me see what else we had. Okay, so and out of that, I mean, we're looking at some of this recidivism numbers. Our recidivism numbers for incarcerated youth are very high. They were over 50%. And then when you look at kids, even now, they're actually higher risk kids coming into care because we're not having that lower risk kid kind of mix in. So our numbers actually kind of increased a little bit as far as recidivism goes. But this last year, we actually had a little decrease. So we have some like semblance of hope here that we are going in the right direction. But that was really some of the reasoning behind this policy, is just knowing that long term, you know, these kids, if they do not have support from adults outside of our system, how do we still provide some of those services for them? Let me see what else we had here. So we had 9 of these kids collect a new felony charge over the last year. So, which is still quite lower than 50%. And then 5 that collected like a new formal probation, or they came back into custody. We had 1 that came back into custody, and we had 1 that came back to secure care. So we're still kind of collecting data on this. It's still quite new. I do feel like it is a lot. It's a bigger bang for our buck to treat kids in their homes and community and try to help them stay connected and have their basic needs met than it is to incarcerate or pull them back into care. If we can help that. So on that end, I mean, that policy piece really does make a lot of sense. So I feel like I talked a lot. Go ahead, Jesse.
No, I think you're 100%. We've got about another minute or two before we get peppered with more excellent questions. And I think the only other piece that I would add is, so we've been working on making expungement more available to our youth that have been involved in our system. One of the unintended consequences of that is we had a youth that came back after their charges were expunged, and so they had no record with us and wanted to engage. And fortunately, it sounds like we had a case manager who was, remembered this youth, and so we were able to kind of figure out finagle a way to get access to that, to those services for that one youth. And so, yeah, I think that's positive too. You never know, like, it's good things, right? Getting the records expunged, and then if the right person wasn't there at the right time, that youth may have not been able to qualify for those services because we didn't have those records available. So I think that's it, though. Kind of like our presentation piece. Yeah, so we'll turn it over to the youth panel for some easy softball questions.
For me, for the hard ones, you can give those to Jesse.
Yeah, my internet's breaking up real quick, so see how that goes.
I feel like there's some mouths moving, but I don't
think we can hear you online.
Can you hear me now?
Yes.
Great. Thanks so much. Hey, Jesse, I'm really glad you added that there at the end, because that's actually my main question that I have for you with the recidivism. And when you have a young person get their records expunged, thank heavens you had a worker that knew that young person. But for the future, safeguarding, ensure that that never happens again, what steps have you taken? Because we can't always ensure that the workers will stay around or be there.
I think if we had a young person bring their order of expungement to us, we would be able to honor that.
Just a curiosity question here, because we all know young people.
Or actually, I should say this too. We do ask all of our young people to sign a voluntary service agreement, and we keep those. So that would be another thing that we would be able to reference back to, is that voluntary service agreement.
Okay, so they don't have to actually have their expungement documents. You guys can go off of that. What if they don't have a voluntary services agreement set up already?
Well, I hope we are. That one we might have to like kind of ponder through. I mean, I don't think there's a perfect way, because the fortunate part of expungement, right, is we have to wipe all of our records from our computer program and any physical documents that we have. And it's like that kid never existed in our system. So some of that we'll probably have to try to see how we can maintain that voluntary service agreement. Or we may have to start educating them a little bit better, I guess, as they go through that expungement process. If they were ever in custody, they probably should hold on to their expungement, court records. And they will need that anyhow for other jobs and other things out there. It's not just, I think we sometimes think expungement means it disappears completely, but that's not always the case. There are other avenues throughout life if they ever sought out specific jobs, like in the military, or I think some of the, like if they were in a religious kind of going on a mission or something like that. There's a lot of things that require expungement documents to move forward in those aspects. So, and unfortunately, I don't think we're all very educated in how that looks all the time, and how many different facets that can actually kind of, bear into. And that's why it's always important to really, these vital documents are really vital for some of those reasons.
Thank you so much for your answer, April. And I will go ahead and pass us on to me.
So you guys mentioning statistics concerning about the proportion of BIPOC kids versus white kids in the juvenile justice system, but do you guys have any statistics that shows any changes in the proportions of BIPOC kids versus white kids in the system since this change had been implemented?
Yeah, I think unfortunately, even still here in Utah, we definitely see the deeper a young person gets in the system, the more disproportionate that becomes. We are seeing, though, however, some really, it's really early data, but some good data as far as our early intervention services and how that relates to BIPOC kids and their survival rate, and not going deeper into the system. But also, I should say, there is a really great website here in Utah as part of the legislation with reform itself. There is some oversight that has to happen with.
April, I'll throw it in the chat.
Okay, sorry, as I'm trying to type, but there's some oversight that has to happen, and there's I can't remember now I'm thinking of the acronym and I'm trying to remember what exactly it stands for, but there's the Juvenile Oversight Committee that's a part of the Utah Juvenile and Criminal Justice. As soon as Jesse pops it in there, sorry.
Is it the red?
No.
Or
I'm going to find that. Hold on just a second. That's one, but it is in this website. CCJJ.
the Commission on
the Utah Commission on Criminal Justice, Criminal and Juvenile Justice, and they're tracking both kind of reform efforts that happen on the adult side and on the juvenile side. And we had some really good reports that came out at the end of this year. for both our like our promising, I'll say promising, not really good, because our recidivism, like I said, is not great, but we are seeing some hopeful numbers going in the right direction. But then on the early intervention side, we're seeing more youth of color being able to engage in those services and actually having a better survival rate and pretty comparable to white kids. So that's also very promising, which we have not seen really a lot of great data on that side for a long time. So, but that was logged into the report this year with the Utah Criminal and Juvenile Justice.
Great answer. That's great to hear that. Your program is shows some promise with the statistics.
Well, and I will say, like, once these kids do reach incarceration in the Utah system, there is a lot of interventions that can happen for a kid before they ever reach us. And a lot of times kids could pretty much exhaust most of the services available out there before they reach us. And they really are the highest risk kids out there by the time they hit our secure facilities. Which we know just from like risk, need, and responsivity, like these kids are the ones that we want to provide those services for and really boost up as much as we can for them. But unfortunately, they really do have high recidivism rates. So I'm hopeful we're going in the right direction.
Thank you so much, April. We really appreciate that. And next we'll pass it on to Julie for their question.
Okay, my question is, how do you see us dismantling the school to prison pipeline, and what resources are needed to make that happen?
I did not really catch that. Did you?
The question is, how do you see us dismantling the school to prison pipeline? What resources are needed to make that happen?
Yeah, I think this reform effort was really telling as far as the school to prison pipeline. At the front of reform, we had a national agency come in and do an audit on our system. And they did find that there were a lot of youth who were diverted from, well, they weren't diverted. I should say they had truancy issues, ended up in front of a judge, and sometimes they contempted their way into custody or picked up other minor offenses. So with reform, it really did crack down on what type of offenses a youth could be ordered into custody for. So right now they have to have 5 previous misdemeanor episodes, and that's not single charges. They could have 20 charges in one episode, and it really is determined by the highest offense in that cluster that happened that one day, or a felony charge. So that wasn't the case before. Like the case before, we could have a kid could literally have a contempt charge and end up in custody. So I think that really was kind of a big positive move for the school to prison to pipeline. This last year, there was actually some legislation that will go into effect this year, just because school safety tends to be a big thing when you hear about school shootings and other things. There was really some I don't think great narrative happening out there, or some misconceptions about what people could do. There was a lot of confusion, I think, with reform and those efforts. I think there could be a lot more efforts done in educating our school partners and law enforcement partners that work in schools on how kids can be charged or not charged in school, where they could be referred if they needed help, and things like that. Yes, House Bill 304 is one of them, and then I think 60 and 66 no, not 67, 61, but there was a cluster of them. There was 3 of them all together. But 304 is a large one. Thanks, Jessica, for dropping that in the chat. That actually pulled back where youth could be charged with infractions in tobacco now, which is unfortunate. And it also pulled back some of the non-judicials. So instead of failing 5 non-judicials, I want to say it's 3, but I could be wrong. But it really did pull back some of those efforts that happened back in 2017. So we'll continue to, work with our school partners to help to, educate and help to have a place for some of these kids to go without going deeper into the system. But there's definitely some work still to be done.
And I'll add to that too. I think part of the problem, like, is a broader system, mental health system, is we often kind of look at behavioral or criminal behavior in isolation and not really understanding kind of the greater context or maybe some of the mental health concerns that may be driving that. And then as kind of juvenile justice and youth services are then tasked to kind of treat criminal behavior like it's this, kind of volitional piece, and just really understanding, like, there's a huge overlap between mental health, substance use, criminal behavior, and like that the schools kind of need to, like, we need to give them some additional resources to be able to kind of look at that, so that they're not just looking like, well, let's just charge this kid and have JJYS kind of figure it out. Kind of leveraging those other pieces and understanding why youth tend to struggle in the ways that they do. And it's not just this volitional, like, criminal behavior piece, but there's often a mental health and a family systems context that can really kind of play in. And if we can treat those root causes, then hopefully we can nip a lot of that in the bud.
Yeah, that's a great point. I mean, I think that's one thing that we have seen a lot more since reform has happened, is we've definitely seen some pretty sick kids that have come through that have needed inpatient stays over detention stays.
Next, I'll pass us over to Trace.
My question is, what mechanism is set in place so that these young people know that the system has changed and that this policy has changed? So let's say, for example, that a young person who is eligible for these services does not know that it currently exists. Is there kind of like an outreach plan set up to reach that young person? And how would that factor in with those young people who've had those records expunged?
We haven't really had an outreach effort for past clients, but as kids are aging out or leaving our system, I shouldn't say aging out, but as they're leaving custody, their case manager sits down and gets that form signed and explains kind of the different options that they could come back and receive those services. And then sometimes some of our kids are engaged in something, so we have a lot more, since we're serving older kids, we have a lot more education services and vocational services. So we might have been paying for some of those. So instead of just saying, hey, you're getting out of custody and now we're going to just drop you, they'll explain that they could continue to get some of those services too, or they might help them to apply for grants or other things too out in the community. We have had some older kids come back though in this last couple of years, and I think our one kiddo that Jesse talked about that had his expungement record was a 23-year-old youth, and he was just looking for options and didn't know that we had this other opportunity, so we were able to just help him out with that. We've also been making sure our private providers know that this is an option too, because a lot of times, kids will go back to where they felt safest, right? They'll go back to their old therapist or to an old proctor home or somebody who had provided some services with them. So they also know to refer them back to us for voluntary services.
Fantastic. Thank you so much. I just had one last question. I'm just curious as to how your young people in JJYS services were involved in the implementation and bringing this to the policymakers. How were they involved in it legislatively and just the whole way through?
Well, I wish that I had this great story about how our young people are greatly involved in all of this policy making. We're still trying to get better at this. And I think part of that is we have, incorporated our youth coordinator who has lived experience to be able to work with the kids that we have in our facilities and programs and things like that. We're sending policies to those kids that directly involve them to get their feedback. And it's quite interesting because there's been several policies that have gone through our policy committee and up to our EMT, and then it goes back to the kids and they find all kinds of stuff that all the adults missed, which is great. So we're still working on it, but we will get better. I mean, we also recognize that we really had this disconnect from our refugee population. So we also hired a refugee coordinator who's housed out of the refugee center. And he helps youth and families to navigate our justice system. And he's killing it. So we're really excited about those things as well. Yeah, like I said, I feel like I learned a lot from you guys sitting on our youth and transition committee, but also, we're learning all the time.
I really appreciate your answer to that. I think sometimes we hold ourselves to this expectation that we're going to be at the top rung of the ladder, right, where we always want to be, but it's baby steps. And I really appreciate your willingness to say, we're not exactly where we want to be, but we're on our way there. So really, really thankful for that. Thank you. Do we have any online questions?
So it looks like there's one on how are we partnering with the mental health providers to increase treatment options for youth in custody, specifically inpatient? Is there policy that needs to be addressed to ensure treatment and follow-up? I'm going to let Jesse answer this because he's been doing an awesome job making a lot of friendships out there. But I will say it has been quite discouraging over the last few years playing hot potato, like not ours, but go ahead, Jesse.
Yeah, I think, this has always been kind of a problem. I think it is especially pronounced for a lot of reasons that we could spend a lot of time talking about, but that's probably another presentation for another day. I think, I think that last piece of that question is the really compelling one as far as like to ensure treatment and follow up. I mean, that really is the hang up because, how do we kind of compel, I guess? I mean, if you don't and families don't want to participate, we don't have a lot of options to compel youth. And I would also argue that like compelling treatment often doesn't really help kind of pursue the outcomes that we're looking for. And so I don't know that we have like a real silver bullet as far as like how to do the follow-up piece. And, we've got really kind of a problem. I mean, I think last week we had a youth in an emergency room waiting for an inpatient bed, and there were 22 youth in front of them and waited like eight days. And that's not getting any better. And so I think, whether it's policy or funding, like we really do have an epidemic in the level and complexity of the mental health needs across the board. I mean, we've got our anecdotal situations and things like that. There's just not, and then hospitalization too. I mean, by no means is like a silver bullet, a few days in a hospital and some medication changes doesn't really change often the underlying problems. It can sometimes. And when we're talking about, early episode psychosis or first episode psychosis and that kind of stuff, yeah, for sure, inpatient hospitalization can help out with that. And, what does good comprehensive follow-up care look like to really treat the issue? I don't know that we have a good answer than that, other than it's going to be expensive. And I think, that's kind of the dirty secret as far as that is like, it's going to be really expensive to be able to provide that comprehensive care. And you know, I've got a friend who's also in this conference, kind of live tweeting me here on the side. You know, I forgot to mention that youth was sitting in shackles and handcuffs for 8 days in the ER while we waited for that bed as well. And so that's like some of the problems that we have to access. So I don't know. I think we've got the policy in place to be able to do that. There's just not a lot of funding to help facilitate those outcomes, especially on the back end. We can get them into an inpatient setting, but that's often not the silver bullet that's going to fix everything either.
Yeah, there was one other question here online too. Do we have any training or education surrounding how intellectual and developmental disabilities play into all of this? And Mary, you're absolutely correct. And I think that it's even, I think this is one area that there isn't, like in our D-speed system, there isn't a huge disparity because those poor kids are not getting identified. Those are the kids that are like getting kicked out of school. And I'm always amazed how many youth that we qualify for disability services once they make it to us. And unfortunately, a lot of them are Black and brown kids.
April and Jesse, we do have a question from one of our in-person folks. Do you want to? Yeah, or do you can come up. And I will add, Mary, just to this, the intellectual and developmental disabilities, we do have a team member within the Office of Substance Use and Mental Health that is working on how we serve folks within our mental health system who have intellectual and developmental disabilities. And I imagine that this discussion is kind of part of her plan, but I could get you connected to her.
Well, and for us as a system, really challenging ourselves to better address those needs rather than just like a correctional perspective or just even like a behavioral perspective. Like we've got a brand new, well, no, she's not brand new. It's been a few years now, but she feels brand new. A clinical behavior analyst who's also a licensed clinician and a behavior analyst to bring kind of like a trauma-informed behavioral perspective to the youth that we work with, which I think is really great.
Hi, my name is Princess Salazar. I work in a privately owned residential treatment center. And as someone who went through programs in the state of Utah, I also know that this is not the answer for what we are limited to. And I'm pretty frustrated with continuously hearing, you know, our hands are tied when it comes to kids being able to have voices with their own treatment and what that looks like. So with us being private, we're trying to move forward into how we can help support this transitional phase, because within this last year, a numerous amount of kids who parents have gone MIA or they're just not being supported. And again, we just come to the conclusion of, well, we're just throwing them back into the system until they're 18, and then they're back into their communities with no sense of direction or support. So I know you guys kind of already answered it in saying there's really not much available, especially within the state of Utah, but is there anything we can do for programs like us who are wanting to go into that next transitional phase, that whether it's partnerships or helping with that policy or organizing, fundraising, anything like that? Because I think we all share similar kind of values and wanting to move forward. I think it's just, how do we do it and where do we start?
So let me ask you if I understand this correctly. So you're saying as kids get ready to transition out so you're involved in a private pay program.
Yes.
So do you get a lot of kids from out of state?
Yes, so we have out of state, but we also have local. We have a lot of kids that come through California Adoption Agency who
Okay.
pay up to the day before their 19th birthday, but
Yeah.
their parents are still able to make the decision for them. So even at 18, I mean, they wanted to stay here in Utah, but I couldn't find anything to
Transition
help them.
services.
Yeah, that didn't cost, you know, more than $10K a month.
Yeah, that's a great question. And I'm not sure if people really realize how big of a mecca of private pay programs and kids that are sent to Utah to receive services. And this is, and I don't know, I'm going to say that as far as the transition side goes in the pay, because it works differently than how we contract for services with our contracted providers. And I think going back to that Families First Services and Prevention Act, this is something we did in Utah, and we don't send very well. I won't speak for DCFS because I don't know how many kids they send out of state, but for speaking for us, we do not send kids out of state anymore. The last program we had, we stopped really sending probably about 4 years ago. We sent maybe 1 or 2 kids over a 3-year period. For part of that, it's hard to transition kids back to their families and reintegrate them into their communities without being present in your community. So with the Family Services and Prevention Act, let me give you one other caveat. They had this early intervention piece, and what we had to opt into to get the early intervention side is a qualified residential treatment program. So it required our treatment programs to be accredited. We have to have clinical indication along with our protective risk assessment that indicates that level of care. And we also, with reform and also with the Families First Services and Prevention Act, it limits how much time they can spend in residential, which is amazing. Like if you've been in this business, more than 10 years, you've seen the change that has happened. We've gone from kids who probably spent 3 to 4 years in residential programs down to we are trying to get them back home within that 3 to 6 months and get them out of custody within that year with aftercare services. So that's the hard part. And when you're talking about this transition side, that's why we built in this voluntary service agreement for our kids who did not have families that would take them back. So we had other avenues to kind of help them move forward instead of being stuck in a residential program. Because let's just face it, like for a kid to grow up 3 or 4 years in a residential treatment program, that's your high school life skills that you're missing out on. Some of our kids were going in at age 12. That's middle school and elementary school you're missing out on. Those are things we can't get back very easily, right? So that's been the push here for our local kids that are in custody, is really to get them in and out of congregate care very quickly and get them back into their communities and integrated back in. I'm sorry, I don't have a better answer for the private pay out-of-state kids.
No, not just the out-of-state kids, but like I said, we have local too, and the parents, when they say kind of you figure it out, it's hard to find anything here in Utah with that support system.
Yeah, especially when they're barely 18 years old and they haven't had to do any of that socialization on their own.
Thank you for answering my question.
Thank you, April and Jesse, so much for your time and your presentation on this policy. I think I speak for myself and the rest of my panelist members that we're just so excited to see what comes from this and the growth that you are all able to make. So thank you so much for your time. And we're going to close out for our first day of Utah's Policy Summit for Youth in Transition Policy. I want to thank you all so much for all the amazing questions, contributions, and your time for being here with us today. And we hope to see you all tomorrow. Thanks so much.